Hello everyone, I'm Karolina Mackiewicz from the European Connected Health Alliance, and as the SmartWork project is coming to an end, I'm joined today by the partners responsible for the pilots and the coordinator to talk with me about their expectation, hopes, and the results of the pilot projects in Portugal and Denmark, and also the next steps for SmartWork. So I'm joined here with by the Elizabeth Pitarma and Flavia Rodriguez from Caritas Coimbra, Tom Thomsen from the Center for Assisted Living Technology in Aarhus, Denmark, and Andreas Raptopoulos from the coordinator organization BITE. Welcome everyone, and as I said, I have some short, small questions to you as Flavia and Tom as coordinators of the pilot projects. So can you share with us what were your hopes or expectations for your organizations when joining the project and starting those pilot projects? Flavia, would you like to say on behalf of Caritas Coimbra?
Yes, I can start. So the expectation of Caritas Coimbra in participating in the SmartWork pilot in the first place was the possibility to answer our employers' needs. So considering our structure and services that we provide, we have a huge number of persons with more than 55 years working with us now. So SmartWork is a possibility to improve their quality of life in work and provide to them some tools, some technical tools to work with good quality. The other projects that we participated before were only, we only have end users that are older adults. So SmartWork brings this difference that we can bring innovation also to our workers. So this is the first thing. So also we have the hope to contribute and provide healthier and friendlier working environments for our older employers that often have some weaknesses and diseases, but who are still far from the retirement age. We believe that investing in innovating and research now, we can contribute to the persons that we now work and need some quick responses, but also for the future. We are getting older and we need to look to our quality of life now and beyond.
Brilliant, thank you so much. And what about your hopes or expectations, Tom? Were they different at CAT from those of Flavia?
No, Flavia said most of it already, but I certainly have something to add. In this Center for Applied Technology, we have tried an awful lot of things. The interesting thing about SmartWork is there is something new in SmartWork, and apart from wearables and from measurements and whatever, the new thing is actually applying artificial intelligence in order to generate interventions. Because I think most of us, we already know what wearables they can do, and also very, what should you say, novel variables. But the fact of actually intervening towards the users, that is the big thing about SmartWork, because we've never seen that before. And especially the capability of individualizing the individual colleague here at our place, that is something which is quite outstanding. We have never seen that before. That's what we're looking forward to. And of course, also what Flavia said about improving the quality of life for our employees, and well, that's important. We have another idea, we have another perspective too, because now we are municipal with 16,000 people. And one of the big tasks going on here is to provide care and caretaking of the citizens. If we could spread some of the SmartWork features onto the citizens who are receiving services from the municipality, we might achieve something that we have never achieved before.
So perhaps this brings me very smoothly to the other question. Like, do you think that then SmartWork brought the added value to the organization, and do you think that it could be actually used after the pilot and also deployed to on a wider scale? Tom, so would you like to take this from as the follow up of your previous answer?
Yeah. Well, we certainly hope so. Now, first of all, let's finalize the project and conclude what we have been able to do and what we have not been able to do before taking steps to the next project. But I think now we have been focusing on the plus 55 years office workers, and that's fine. That's very fine. You have to start somewhere. But if we could spread this beyond the office environment and could spread it on also to ordinary citizens who have the need for care and interventions in order to change their own behavior towards a healthier life, I think that would be just tremendous. It would be fantastic. Mm-hmm. So whatever comes after SmartWork, I think we will certainly be interested to be on board to participate. But I will also say that we are sort of converging towards what are our goals. Our goals is simply to economize and increase quality of public care.
Mm-hmm. Thank you for that. And Flavia, would you like to comment? Do you think that SmartWork brought this added value, and can you imagine this being deployed on a wider scale in Coimbra or in Portugal?
Yes. Our view is that all the research projects always bring some value or new learning to the organization. So with this project, we could hear the opinions of our workers and understand their needs and their problems and try to implement this in the project. So other thing is that it was possible to improve their digital literacy, because many of them still need to study these kind of technologies, and they need to open their mind to new technologies. And this was for sure an achievement of the SmartWork project. The acknowledgement behind the SmartWork project is awesome, and will be useful when we have the full operation of all the devices. So the app with most adherence and that users showed the willingness to continue to use was the Healthy Me, the activity coach. I think in this issue, the participants felt encouraged to be more active, and they can see the results immediately because the assistant sends the information to them every day. So this was very important for them, because they understand the advantage of physical exercise, and some of them felt really motivated to do something and achieve their goals in their healthy part of the life. So I think this is one of the possibilities to see in a bigger scale in our organization, not only for those with more than 55 years, but I think for all of them, because this is important not only for the older persons, but to all our workers. I think for sure when we are working, we don't think if we are stressed, we are focused on our work. So I think the principal output of the SmartWork system and this improvement is necessary to be used after the end of the pilot. I think because lots of our users regarding the other service that they for sure bring value, but the systems are not quite perfect. So one of the issues pointed out by our workers that test the system was the lack of feedback that the apps gave them during the time of use. So they prefer the other one because I think they received the feedback, but the others, they don't receive instant feedback. So they have to search. For example, the environmental box is important because they are concerned about the quality of the air, but they have to check in the online dashboard. So the feedback is not in the moment. So this is very difficult for them. So I think these are the improvements that we still need to do to have a wider scale to the project.
Super, but this already sounds very encouraging. That based on the pilots and this small scale deployment, we see the added value and also the eagerness to continue with developing and using SmartWork. So that brings me to our coordinator, to the leader of the project, Andreas Raptopoulos from Byte. Andreas, tell us, what are the next steps for SmartWork? SmartWork ends in 2 months, and then what?
Okay, we can see here, and as the previous people said, there is a wider audience that we can address, from older workers to the entire workforce. Imagine that companies around the world are facing problems like absenteeism and presenteeism. So this usually cost per employee 34 working days per year. So due to bad health or due to stress and bad, not very good lifestyle, this cost a lot both to the workers as well as to the employer. So we are here as a project produce very, very nice ideas in order to continue the work and also enter in the field of corporate wellness, as we call it, and produce solutions that actually will have an impact to the employees as well as to the employers. A major thing that SmartWork provides is that actually it connects to the employee experience with actionable insights for the employer. So it gives, let's say, be able to understand the impact of not very good working condition or not unhealthy lifestyles to the working environment, and help both factors to take good actions in order to keep the employees healthy at work. It's very, very important, and actually have, in commercial terms, a positive ROI. In terms of research, a lot of work has been done. I think the next steps will have to do with the further development of the AI tools, while I see a lot of impact in the sensors that and devices that the SmartWork brought into during the project and the pilots. First of all is the wireless mouse, produced by IPN, that can be able to measure a lot of, let's say, vitals from the employees, as well as the environmental sensor that combined with ergonomics within within the working environments can create working environments that are actually healthy and very pleasant for the employees to work on them. Keep in mind that also taking into account the COVID-19 pandemic, let's say the need for keeping the workers healthy became even more imperative. So solutions such as SmartWork have a lot of potential to contribute towards this direction, not only to the older workers, but all to the entire workforce.
Mm-hmm. And what would you say to the organization or to the individual that is interested to start using SmartWork? What should they do?
To go for it. This will become more evident also by analyzing the results of the pilots. We had produced very promising results. So actually we can demonstrate the impact of the project in terms of, first of all, the good things that can bring to the employees' lifestyle and health overall, as well as to the acceptance of the majority of the solutions produced to the project. So I think that based on these two issues, we should first of all go for a large scale implementation. That is would be very nice to see how the entire system behaves within, let's say, an implementation of 10,000 workers. And of course, just many of the outcomes and outputs of the project are combined with a business model that actually can prove the feasibility in business terms. So I think that taking into account these two factors, I think that we produce things that are actually exploitable and can be applied to any organizations that would like to use them in the near future.
Mm-hmm. Thank you so much. So as we heard, the project is ending shortly, but the work continues. SmartWork has a lot of potential, and if you would like to deploy it, learn more about it, visit the website smartworkproject.eu and connect with me or with our fantastic partners. So thank you so much for joining me today, Elizabeth, Flavia, Andreas, and Tom. And I wish you all the best for the future of using SmartWork and improving the quality of life.